Part of our mission at Harris Health System is to not only educate the next generation, but to do research and to look at ways to improve patient outcomes so that we have the best quality outcomes. Nursing has embraced that mission and also want to be able to drive improvements in patient care through research and through scholarship. Part of what nursing has done has been to develop a team, and we call them our Inspire team. That team of nurses understand the framework and the concepts of research, evidence-based practice, and they in turn now are inspiring, motivating, and influencing nurses across our system to continue to do that at the bedside every day, to pay attention to what's going on with the patient and to begin to ask the questions and think about the things that could make it better, and then to move that forward into the research project.
Nurses, particularly those working at the bedside, really have the best ideas for research. They are right there with the patients 24 hours a day, 7 days a week. The way our nurses usually start is by asking a clinical question, something that we want to discover that's going to help us give the best patient outcomes. And so we look to whatever technique is the most optimal to get the answer to that question. And sometimes that is doing an evidence-based practice project where we're looking for additional evidence, critically appraising that information, and then deciding what we can actually put into practice that is going to give us a more positive difference in our patients.
Something that we're really working towards in ambulatory care is really raising that bar of our RN to actually practice at the highest level of our scope. So part of that is our nursing staff identifying those areas that we can improve our patient care to improve outcomes, and then working as a team to help drive that. I think it's really hard to do that individually. So when you have these Inspire teams together to help drive for that improvement and that change, it's much more successful. We already have 3 poster presentations that are being presented at Pathway Conference, which really just speaks volumes to the fact that our nursing staff is engaged. We have nurses that say they were complacent before our Inspire team was put into place, and now they're actually engaged to improve our practice.
One example of an evidence-based project that one of our staff nurses is currently involved in is nurses always have to start IVs. And when I say IVs, it's a stick where we're putting a line into a patient, whether it's to draw blood or to give fluids. This nurse actually made a prototype of an arm where nurses are now practicing that they can use this instead of sticking patients. They can use this prototype to start IVs to get the practice, because anything with nursing, you only learn it through practice. It started in the EC, but now it's throughout the hospital, and other hospitals are looking at it also.
So one function of Inspire is for each nurse to share their specialty to the rest of the community or the rest of the nurses of Harris Health. For instance, as a psychiatric nurse, I can share my knowledge of suicide prevention, being aware of signs and symptoms among their patients before anything happens, or signs and symptoms of addiction. Sometimes it takes practice to pick up those things. But I think through education and making the nurses aware, I can help educate the other nurses to be more aware of all these problems.
Through our Inspire team, we are working to coach our nurses to engage more in evidence-based practice and also nurse-led scholarship, because we are dealing with a human life and we have a duty to provide safe patient care to our public.
Once we get our data back, the critical thing that we have to do then is disseminate that information, because if we don't disseminate it, it's not going to help other patients outside of just our little population that we just found this to be beneficial in.
Our nurses have really excelled in that. There have been a number of publications. I think we're at over 60 peer-reviewed publications. Most of those are in top-tier journals. And then we've also presented both podium presentations and poster presentations at regional, national, and even international conferences.
Today, I came from a conference where we had 20 posters displayed that nurses from every single one of our venues, our 3 hospitals and our ambulatory care clinics, posters of the evidence-based practice projects that they have done, and they show in their posters the outcomes they've achieved with patients in every single one of them across our entire organization. So I'm really proud of that because 20 is a lot, and those are just the posters. So just the amount of work that our nurses are doing, the fact that they have just sponged up what we're teaching them about this, and now they're really beginning to disseminate and showcase that out in the community and out to patients and out to other healthcare facilities. I'm most proud of that.